Hey there, folks. I'm Keith Reynolds, and this is Practical Management from Physicians Practice, the show built around what practice managers actually have to solve. Today, direct primary care and concierge medicine. These membership-based models are no longer niche. They're scaling fast, and they're changing what primary care looks like. A health affairs study found that the number of concierge and direct primary care practice sites grew 83.1% from 2018 to 2023, and the number of clinicians working in them grew 78.4%. But here's the twist. Corporate ownership is showing up fast. Corporate affiliated practices rose 576% in that same window, and independent ownership fell from 84% to 59.7%. Beyond that, the growth in these practices seem to be clustering in states like Texas, California, and Florida. Is it wealth, regulation, or something else? I asked Dr. Jane Zhu of Oregon Health and Science University, who is the lead author on that study, what could be causing this.
I think it's just a matter of demand and market opportunities and pressures. I think the rise of concierge and direct primary care models is really reflecting some real needs, a simple demand in the market, which is that people are willing to pay for more personalized care and better access. Part of the reason that we might see some concentration in certain states is because, there is a greater need, population level need in some areas.
Now, policy might pour fuel on the DPC concierge fire. Starting January 1st, IRS guidance tied to the One Big Beautiful Bill Act allows HSA-eligible individuals in certain DPC arrangements to contribute to an HSA and use HSA funds tax-free to pay periodic DPC fees.
So substantially, I think that federal policies, state policies, they create incentives for people to enter into these sorts of practices and for these practices to grow. In the past, it was not readily available for people to use their health savings accounts to pay for membership fees associated with these models. And now it's a possibility, and you can use your HSA to pay for this as a medical expense. I think that will expand participation in these models both by clinicians and by patients. The key question is whether the expansion of these models at scale will meet those demands right now. And again,
while this can be seen as a positive as more people can receive primary care services, Anders Gilberg, Senior Vice President of Government Affairs at MGMA, warns that legislators shouldn't put all their healthcare accessibility eggs in the DPC or concierge basket.
Well, I think they just need to be careful because not every patient can be in direct primary care, and not that we don't have a lot of members of ours that may be in those type of arrangements, but you generally have to have the resources to do that. And oftentimes we find the patients with the most chronic conditions, the most needs, are not likely to be the ones in those arrangements.
These models are growing because demand is real, and now government incentives may accelerate it. For practice managers, the practical question is, if membership medicine is arriving in your market, what does it mean for staffing, payer strategy, and access for complex patients? I'm Keith Reynolds. That's Practical Management. I'll see you next time.